Hey, what's up? It's Dan here. So today we're going to talk about rib position and talk about what causes ribs to be misaligned and how it relates to the shoulders, to the hip, to your neck, and to your body. Now, ribs are something that they're a little bit trickier than normal joint pain because the ribs aren't directly influenced by any joint. There's no muscles necessarily, besides the diaphragm for breathing, that really move the ribs in certain directions. So the ribs often play a big role in relation and sort of as a resultant outcome of hip and shoulder movements. Because when you bring your shoulder one way, your rib's going to come with it. You bring your hip the other way, the rib comes with it. So the rib tends to move with certain joints, with the shoulders, with the hips, but they don't necessarily move on their own. So when you have to realign a rib, it's a little bit trickier. I mean, it's doable. It's a little bit trickier. It's a little bit, I guess, less direct is what I'm saying. It's not, oh, you just do this and this. So the ribs, like I said, very related to the hips and the shoulders, and also very related to your breathing patterns. And a lot of people don't know this. When we think about ribs, you often think about the lower part right here, but your ribs actually go all the way up. All of this is considered your rib cage. Your rib cage literally goes around your body, around the collarbone, to the top of the scapula, through your back, and on all directions. And these ribs, of course, serve a very important purpose in protecting your vital organs and preventing, some sort of outside force from damaging them. So they're very, very important. And they also play a massive role in your posture. And because when you breathe and your ribs expand, that's what creates the space and the expansion needed to stand tall. And so the first thing I look at when I assess people's posture is often their rib position. And we can see this especially when you look at someone from the side. When you stand tall, what you should see is basically a straight line. We're in a shirt from your back to your front. You should be able to get good expansion through here, get your chest be able to get pretty big, and you should see a straight line. What I often see is people are very shrunk. They're very collapsed here. And that usually means they have anxiety, the psoas is pulling them down. They're not able to get full expansion through their chest. And the result is their posture is flat. Then oftentimes what we'll see like the very thin types where it almost, like when you look at them sideways, like you barely see anything there. Those people also fail to get expansion through both ends. The result is their back looks flat, looks thin, and then they look thin here. And so they look almost like wider but not very thick. So that's another problem. Then we also see, of course, is compensation. That someone has like an anterior pelvic tilt, you'll see the ribs flare out. Or we've seen someone has a posterior pelvic tilt. Oftentimes we'll see the ribs shoot back. So the ribs are very, very related to your pelvis. And whatever position your pelvis is in, your hips are in, your ribs are going to move in the opposite direction usually. Because your body is always trying to fight gravity. It's trying to fight gravity in every single instance to try to keep you upright. So if your hip is going to the side, what's going to happen with your ribs? It's going to try to shoot the other way because your body just wants to fall over. It wants to fight gravity. So the ribs will shoot away to try to get you to stand upright. And we'll see this with, if I'm shifting to the right, my ribs will probably shift to the left. So your ribs will shift in the opposite way of your hips. And then we see it, like I said, anterior pelvic tilts and posterior pelvic tilts. This one has a real big anterior pelvic tilt. Their ribs will flare out because they don't want to fall forward. So they flare the ribs out to get their shoulders back. And then you see that posture. And then for a posterior pelvic tilt, they're shooting forward. They want to fall back this way. The ribs will shoot back and their head and shoulders will come forward to counterbalance that in order for them to stay upright. And so we do see this a lot with rib issues. And that more so also causes a lot of flattening that we see in the front. Inability to expand through here and flattening. And then on top of that, we often see rotation issues with ribs. And this is related to the shoulders and the hips. So one hip might be rotated more forward than the other. the rib will rotate back and the shoulder will rotate back. And so we see that with the other side too. So the hips rotated too far forward, back. So this is something we often see. And so when it comes to rib problems, and especially if it is a problem with rotation, I've had that before too. Oftentimes it can be a shoulder alignment issue. It could be hip and shoulder. Your shoulders coming too far forward, the muscles in the pec and around the collarbone are really tight. They're pulling your shoulder forward, the rib comes with it, and you start feeling pain. So very, very related and connected to the shoulders and to the hips. And so the first thing I have people do usually is just starting with breathing. First thing, address the stress issues, because a lot of the rib issues come from stress and fear and anxiety, which is also fear. So what we do is we're going to release the psoas first, and I'll show this in a different video, but we're going to release the psoas first, and what that's going to do is it's going to help get more filling, because the psoas pulls the ribs down and compresses this front line, which makes it very difficult to expand in these ribs. So first thing is we have to release the psoas in order to free everything up so you can fill with air. Then the second thing I have people do is I start having them breathe and learn how to fill their ribs. Because when you breathe, you want to see these ribs fill up in all directions. You want to see expand in all directions, because your diaphragm controls your rib alignment. So when your diaphragm, which is like a mushroom-shaped muscle that sits in your rib cage like this, when it contracts, it flattens out and expands in all directions. And this creates expansion in your ribs, which then allows for your lungs to fill with air. You take in a deep breath, you get the oxygen, and then you breathe it out and you let it go. That is very important, and this is often what we see compromised in rib problems. So what I'm gonna have you do is you're gonna lay on your back. I don't even want to move this camera, so I'm gonna stay standing. And you're just gonna lay on your back, arms to your sides, and you're just gonna practice breathing in and trying to expand your ribs in all directions from the inside. And really focus on getting the chest real big, real expanding through here. Expanding through the back as well, pulling the shoulder blades apart. Getting a rounding, so filling there too. You can also go into like a cat-cow, like a round out. Fill there, then you can get big chest. Fill here. And do that. And start to notice where you feel like it's restricted. And then when you find where you're restricted, what I want you to do is you're gonna find your ribs and you're gonna start putting your fingers in between the ribs right by the sternum. So sternum's right here. So you're gonna feel in between the ribs, put your fingers in and start working on the tissue and push in and really push in and really feel it. If you're someone who's very compressed here, like I've described, because you should be more here, you're gonna find it's extremely tight in here. It's gonna be extremely tender, very, very tender. And so what you're gonna do is you're gonna take your fingers, put them each rib slot on those muscles, and what you're gonna do from here, push in, take a deep breath, and try to expand those ribs apart. Because you have muscles here called the intercostals. And the intercostals really work to help expand the ribs so that there's expansion and then the lungs fill there. So they work with the diaphragm. There's intercostal muscles that help expand the ribs and contract the ribs. So getting the fingers in there and working through that tissue is going to be very, very instrumental to getting that proper expansion that you're looking for. And this is going to take time. You can take 20 minutes and just work on this and just try to open all this area up. Really notice where you're tender, because for different people it's going to be in different places. You can feel a lot of times people get tender here, especially if they're in a state of anxiety or fear. Here is also very tender. You can also go to your sides and feel here. This is always a pretty sensitive area. You can even go into your back and just feel things out. And you'll notice that there's tenderness all over. So working to expand those ribs in all directions is going to be very, very valuable, because like I said before, your breathing really determines your posture. If I'm like this and I take a deep breath, you're going to notice that my posture resets itself. Everything expands, even the spine decompresses, and then it contracts again as I breathe out. So as you breathe, your diaphragm expands the ribs, everything fills with air, and then as you breathe out, pushes back down. So we see is some people are stuck on the inhale, some people are stuck on the exhale. Some people are stuck like this, they just kind of stay there, and then other people are stuck like this, almost like they're letting out a sigh. And this has a big relation to emotions as well. You know, what emotional state you're in. You're trying to be ready and ready to do something, or you feel like you have to be a certain way. Let's see this with like soldiers, or if you're just kind of, you know, dejected and letting out a sigh. So really important, learning how to expand that properly, address the emotions. Now let's talk about rotations. This was like 3 years ago. I actually had a rib injury on my left side, and it was just really painful. It was just painful. This was when I first started my business. I had cut my gym membership. I'd stopped going to the gym for a little bit, and I was starting to get pain through my rib. And I kept trying to work the rib and try to figure like what's going on here? Like, why is it so tight? It turned out the problem was my shoulder. I was driving my left hand. That was part of it. And my shoulder was actually rotated forward because my collarbone was getting pulled forward and it was taking the rib with it. So this is very, very common, and what you want to do is, as you breathe, really focus on inflating through this part of the shoulder. And expand through this part of the shoulder and through the muscles here. The shoulder will naturally start to fall back. And that's good. And what you can also do is you can help turn out and contract the muscles in your back, open this up even more. Like I said, do this on the ground. It's better on the ground. I'm just doing it right here because I can't move my moving my camera is a little bit of a distraction, but coming here, just expanding that. And that'll be very, very useful for you. And so if you have this shoulder, what you can also do is you can take a lacrosse ball and put it against the wall and work through the muscle. You can take your fingers and start working through this tissue. Work through the pec and work through where it connects to the shoulder. Work through the front of the shoulder too. All this is going to be tight. If you find, like if you have tension and your pain in your left rib and you notice your left shoulder a little bit forward, start working on the area. Really start working on that shoulder first, working on driving it back, because shoulders go bad when they start falling forward. When they start falling forward, they lose connection to the scapular muscles, which is where all the stability happens. The rotator cuffs are back here. And when this happens, that's when we see shoulder problems. So really learning how to expand and get the shoulders reconnected and really feeling it connect to the scapula is going to be very, very important. And open that up. And as the shoulder goes back, the ribs will go back too. You can also work your way into a position like this, like the end of a row, where you're squeezing really hard. Do that, start expanding through your chest even more. And as you do that, the contraction here will push the ribs forward a little more, and you'll get more expansion through the chest. And then, like I said, you can also go the other direction. So those are some things to try out. Really start working on expanding your ribs, seeing where they're locked up, where they're off, whether it's compressed in the front and shifted backward, whether it's anteriorly tilted and arched up, whether it's you have a hip shift to one side, your ribs are going away. Oftentimes we see a side rotation and backward. So, and see which shoulder and which hip are rotated forward and back, because it's very, very common we see with most people that one side's rotated forward, one side's rotated back. So you usually have some sort of rotary compensation that occurs, and that's going to impact the rib as well. So those are some things to look into. Let me know if you have any questions, and I hope you have an awesome day.